How is everyone doing? Hope everyone's doing well on this Friday and getting ready for a great weekend. Can everybody hear me good enough?
I can hear you great. Hi, Darrell. Hello, Pauline. I'm sorry, I was just coming out of another presentation, so I'm glad to be here.
Yes, ma'am. Yes, ma'am. So my name is Darrell Barrett, and I'm Dr. Soli, and I will be doing this presentation on the effects of concussions on an individual's mental health. And this has been something I've been thinking about doing for a long time. I've had experiences of the effects of a concussion, of multiple concussions. I played football throughout my life as an adolescent, all the way up until senior year, freshman year of college. So I've experienced quite a few concussions in my life. I want to say more than 3, maybe 5. So what I want to do with this presentation is bring more of an awareness to concussions and the effects of mental health. And what we're going to be discussing in this presentation is more of that, more of an overview, so we can ask more questions, explore more behaviors associated with concussions, also ways that we can advocate, things that we can change to reduce concussions. So you have any questions, anyone, comments?
Yeah, and
Dr. Soli?
Yeah, I was I'm Dr. Lori Soli, and I'm a professor here in the program. And I was really excited when Darrell reached out and said that this was something that he was passionate about and wanted to present on, because I have, to the best of my knowledge, never had a concussion. I do have a son who participated in football and had concussion, you know, it is definitely something that I don't think that as counselors we are as aware of as we possibly could be. And so I was really excited that this is an area of passion for him, and to be able to support him on this journey. Darrell will be, for the most part, our tour guide. I will be here as his guide alongside as needed. But feel free to put questions up in the chat pod. I will monitor that, as well as I know our co-hosts.
All right, thank you, Dr. Soli. So let's get into the presentation. So we're going to start with concussions overview. And here we're going to discuss what is concussions, right? Basically what we're going to be learning throughout this presentation. Give me a second, I'm sorry. Okay, here we go. So this presentation is going to explore concussions and associated mental health concerns. Mental health interventions needs to be considered as part of mental health, as part of an individual's overall mental health treatment. This program will address concussion symptoms and signs, how symptoms related to mental health, the myths about concussions, and addresses associated mental health stigmas and biases. These awareness build resources aimed to educate mental health professionals and encourage others who may work with concussed clients to understand mental health decompensation within the population better and encourage supportive mental health treatment. So like I stated before, this is an open forum, just basically general information, just help us explore more on concussions and mental health. So with the program outcomes, participants will be able to define concussions, who, what, when, where, and how. Also develop an understanding of myths associated with concussion outcomes, and develop an understanding of the short and long-term impacts on concussions and mental health, and the common mental health concerns. And participants will also develop an understanding of preventive measures, interventions, and treatment. So what is a concussion? So concussion is a type of traumatic brain injury, or TBI, caused by a bump, blow, or jolt to the head, or by a hit to the body that causes the head and brain to move rapidly back and forth. The sudden movement can cause the brain to bounce around or twist in the skull, creating chemical changes in the brain and sometimes stretching and damaging brain cells. And also MTBI is mild traumatic brain injuries. So we might see that in the course. But I want to go back into the concussion type, the TBI. It talks about the chemical changes. So when concussions happens, the axons and the neurons separate and it releases toxins. So that's the toxin that they're talking about the chemical changes. So the toxins are released and it causes chemical changes as far as behavior, cognitives, and things of that sort. So who can get a concussion? Anyone can get a concussion, right? It kind of depends on the individual. Are we high risk individuals, meaning, do we participate in high risk activities that result or could result in that type of movement or jolting, your body yanking? For example, athletes, we all know football. Football is very common when it comes to concussions. Soccer players are not exempt. Hockey players, we know how violent hockey is. Hockey is very violent. You see a lot of concussions. I mean, we see them fight all the time. So that's another area. Also boxing. Boxers sustain a lot of concussions. Women, men, young or old. So anyone can get it. Just everyday living. Slips and trips and falls, things of that sort. So the International Concussion Society reports that 90% of sports-related concussions take place without the individual losing consciousness. And 1.6 to 3.6 million recreational and sports-related concussions occur each year in the United States alone. That's a lot of concussions. 40% of the athletes with concussions return to play after they should, putting them at risk for additional injury. Concussion diagnosis for people under the age of 22 has risen by 500% since 2010. That's a big jump, big jump. And I want to go back to the 40% of athletes with concussions returning to play before they should. This is something that I experienced growing up and just playing football. If you wasn't hurt, like physically hurt, you get back out there and do it. And this is some of the things that we need to talk about and bring up, in this particular point of view, is because athletes are returning too soon. That's why we have the protocols as far as concussion protocols for football and things of that sort. But like I mentioned before, I remember going in and receiving concussions, even middle school and high school, and it was like, hey, you okay? Yeah, I'm gonna lie and say yeah, because I want to get out there and play, not being real and serious with myself, and possibility of me putting myself in danger and developing more risk. So I think it's very important, especially when we have students, kids, and family members or friends that are athletes and play aggressive or violent sports. So as far as when and how. So when in some cases, concussion symptoms won't show up for hours, days, or even weeks, or even a week after injury. So that's very important. So just because we're not showing the signs immediately, ballpark between the time of injury to maybe a week. Me, I'm safe. I would say 2 weeks, just to double check and make sure. But signs should be between the time of the incident for a week. So if you around someone that has concussion, keep in mind of that. So how can we develop concussions? Falls, slip, trips, and falls, right? Just doing everyday things around the house. Changing a light fixture and you fall, it's a possibility. Vehicle accidents, minor, major, slamming on the brakes to try to avoid an accident. Fender benders, run-ins, run-outs, right? Domestic violence, That's one thing that we don't look at. Being psychology professionals or mental health professionals and counselors, that's one thing that we should also consider when working with individuals that's probably domestic violence victims. Look at to see if they had any concussions or brain injuries as well. Like mentioned before, and I keep mentioning it, it's contact sports. You look at tackling, pushing, shoving, slip, trips, and falls as well, diving, tackling. You look at soccer when they're using their head to hit to keep the ball in play. Or just accident when you look at baseball. Baseball players now have the mask where it's covering the side of their face for protection from getting hit in the face with a baseball, right? That has created TMI as well. And also seizures. Seizures can cause concussions, depending on how serious it is and how many. They can actually cause mild TBI or TBI in general. So that's also to take in consideration. And where do we experience these concussions? Recreational sports, right? Soccer, basketball, football. I'm sorry, excuse me. Everyday living, right? Commuting, going back and forth from work, slamming on the brakes, swerving swerving from things and debris in your vehicle that's caused, jolting movements, slip, trips, and falls again, right? Depending on where we work, high risk and physical demanding jobs, right? Military is one of the population that needs to be that needs to be explored as far as concussions related to PTSD. That's one area that they talk about this concussions. Law enforcement, right? Law enforcement officials, they have a possibility of or a high chance of experiencing concussion just due to the everyday requirements of their job. And once again, professional sports, right? Professional athletes, not even professional athletes. I also would say student athletes, middle school, high school, college. And even though it's not a job, but for a lot of students, that's what they're shooting for, just as an employment in the future. So that needs to be taken into consideration as well. Next, we'll be going into concussion myths. So some of the concussion myths are, one, only athletes get concussions, right? That's a myth. And facts is anyone can get concussions. Now, certain athletes are subject to have more concussions than others, but in general, anyone can get them. No one is exempt for receiving a concussion. Another myth is need to lose consciousness to have a concussion. That's also false. The fact is approximately 10% include loss of consciousness. So we have to continue to remember that. Myth, you have to hit your head to have a concussion. And that's also a myth. The fact is that non-contact sports, whiplash, jolts, the shakes, car accidents, domestic violence, things of that sort, can also, we can also receive concussions from that. If you don't have symptoms, you do not have a concussion, like stated in earlier slides, hours, days, and even a week after injury. So it's imperative to continue to look at that within that week time frame. Another myth is you can return to play as soon as you feel okay. And that's a myth. The fact is it can lead to dangerous and even fatal complications. Another myth is you have to keep a person in weight that has a concussion. This is something I've heard recently, and I was always told that, I always believed that, and I was always told, if you fall asleep when experiencing concussion, you're gonna fall into a coma, you can die, but that's a myth. The fact is sleeping is beneficial if there's no internal bleeding. So that's the key factor, internal bleeding. As long as there's no internal bleeding, sleeping is actually beneficial. Any questions or comments for anyone?
I have I guess I have a question slash comment to anyone in the audience who I guess has either experienced this or just like thinking about these myths, because I know that there were some things in here that I definitely had to like set myself back and look at as a myth, but like how do these intersect with 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 your experience of what someone might be presenting in the counseling office, and like how would you like, and you can answer or not, just kind of think about it, but like, why are these myths important to know? I think it's just something that I would pose to you. And Darrell, I'm going to pose to you because I don't know if you know this or not, but we cannot see you. And if it's possible for you to bring yourself back up on video so that we can also see you as you're presenting, that would be amazing.
Okay, yes, but let me see. Not sure why it's not showing.
No, we can see this. We can see the presentation. We just can't see you.
Oh, okay.
Like we can't see your in like your picture or you presenting, you talking like over in the participants. So I don't know if maybe you can turn your video back on.
Let's see. It has my screen showing that it's supposed to be showing. It might have frozen up.
All right, no big deal. It could just be an internet thing, so we can just keep moving on. No big deal.
Okay. My apologies. So we're going to look at the short-term and long-term impacts on mental health. So some of the short and long-term impacts on mental health is memory loss. And this can be considered short and long-term. Me personally, I have experienced memory loss pretty quick. So I want to use for an example, I remember, and I talked to Dr. Soli about this the other day, I had received a concussion during a game, and we'll say a few days later, we were watching the film, and I remember receiving a concussion, and I'm going to say I probably received a concussion in the second quarter. I don't remember the whole third quarter. I'm watching myself on film, and I have no recollection of what I was doing. Like I was watching myself like running routes, running plays, and I don't remember none of it. Like it's a gap. And to this day, I still don't remember. So it's very important that we stress that memory loss, short term and long term. Confusion is very, very, very prevalent in it. These are some of the effects that you actually see within that first week as well. Impaired judgment, impulse control problems, sensitivity to light, and that's short and long term. Dizziness or drowsiness, you start seeing that. Vision impairment, that's considered short and long term as well. I experienced colors, right? The beginning of my slide, you see the color, all those different colors, kind of like, that's what I experienced when I had, several concussions. Like, it looked kind of like that, stars and things as such. The long-term effects, thinking and learning difficulties, concentration issues, basically linked to anxiety. So when we talk about mental health, anxiety is one, depression is very high in concussion individuals that have repeated concussions. And also Alzheimer's is will increase as well as far as long-term effects of continued concussions. Okay, short and long-term impacts, continued depression. So studies suggest that major depression rates may be high as 42% after TBI. And also a study of student athletes, 65 men and 19 women were with 20% increased signs of depression after concussion. So depression after concussion was approximately 35% increase. So with 15 MTBI prevalence of major depression and 15 to 29 other severities prevalence of major depression. So we keep going back to depression, and depression is something that we need to continue to bring up when we discuss concussions. Alzheimer's disease is higher in former NFL football players. There was a study that showed that the increase of Alzheimer's had increased within retired football players and current football players. So they start to see deterioration in the brain.
I'm going to pause for just a second. There was a question in the chat pod. TW asked, does this depend on how often concussed? And I'm not certain, TW, if you could give us, was that on this slide or the slide previous to this? I'm sorry, I just saw this message, previous slide. So the slide before this, Darrell.
Okay.
So the short and long-term impacts. So I'm guessing that you're asking TW if this is, if the short and the long-term impacts depend on how often a person has been concussed.
Yes, that's absolutely correct. So it depends on how frequently you have concussions. The short-term memory and the memory loss can just be short-term to the point where you can, gain your memory back, or you won't have any more of those memory loss issues. But it also, it basically determines on how many concussions you have had and that you continue to have. There are studies that when people who had just one concussion, they probably had some of the short term, but it didn't turn into long term because they wasn't regularly getting concussions. But when you look at people that play violent sports, such as football, rugby, boxing, things like that, where the concussion chances can increase, then yes, you start seeing a lot of the long-term effects. So yes, ma'am, officer, I'm not sure who actually asked the question. Great question. I'm glad you asked it because yes, so if you had a lot or you continue to have a lot, most definitely be alarmed. Any more questions or comments? Okay. So we're going to discuss some preventive measures, interventions, and treatments. So some of the preventive measures to avoid, contact sports, unfortunately, or take a step out of situations where concussions can happen. We in America, right? We love football. That's our culture. We love it. It doesn't matter what race, it doesn't matter, big or tall, gender, we love football. Football that's just what it is, right? So being that we love it so much and we see that and we know that these type of issues are a concern, like what do we do? Like what are some preventive measures? I think these are some of the questions that we need to ask ourselves because I don't think there's no right or wrong answer. One thing I mentioned was flag football, especially into children. You got to realize when we start thinking about MTBI and TBI, right? And we start thinking about the physical aspect of a child, their brains are smaller. Everything about them is smaller, right? They're fragile. So if we put them in these type of aggressive sports at a very young age, they can't put them in issues and put them in place of getting concussion. So flag football is also a preventive measures. Also helmets, protective gear, right? Continue to wear protective gear. I see now in some sports, like I mentioned, baseball, they change their helmets. So they have, when batters come back, they have a thing that the part of the helmet comes around and guards the side of their face. So they won't get hit in the face by pitchers. So as long as we keep talking about it, we keep bringing it up and keep thinking about preventive measures that we can do, we can start trying to curb and start closing in this gap of concussions. And just like regular day things, right? Car booster seats, right? Put our safety belts on, put our seat belts on. Make sure our kids that are supposed to be in booster seats and seats and car seats, make sure they're in those seats at the required age, buckled up fast and according to your state or federal law, right? Keep them buckled in. Because once again, we hit brakes, getting accidents, things like that. We don't want those to happen. But if we take preventive measures to reduce certain things such as concussions and injuries, we should be able to reduce some of those. So booster seats and car seats, seat belts are important. Let's look at school concussion policies and protocols. I'm 40. I played football and we didn't have a concussion protocol. I don't know what a concussion protocol is. I don't have any. I never knew any policy. I've heard of, we've heard of people getting concussions playing sports. Playing football. Even when I played football, I heard people getting concussions, but it wasn't like, oh, okay, you know what? Let's hit this person out for a week to reevaluate them and see if everything's fine. No, they looked at it as a headache. Take you some aspirin, Tylenol. How you feel better? All right, go back. So it's important that we look at these policies, right? If they're outdated, let's update it. Okay, let's keep on asking those questions, update it, find limitations in some of these policies. We continue to grow as a society and as individuals and as culture. Let's continue to look into some of those things to change these policies and protocols, right? So let's adopt, maybe adopt a protocol or policies within the school district so we can enforce it. So adopt, update, and enforce. Breaks in activity. It is reasonable to consider a prolonged period of time away from contact sports for athletes who have accumulated 3 or more concussions in a single season or before age of 18 years old. So when we go, that is very, very, very important because like I stated before, this is a culture. I remember playing football when I was 8 years old. So they're playing football 5 and 6 years old. So keeping that in mind is important. Also keep in mind is if you have a 6 or 7-year-old or a 5-year-old that's out playing football, how do you know if they experience a concussion? Like ask those questions, like how will I ask? Like how will I present it to a 6, 5, or 7-year-old, even an adult, to see if they have concussions or what type of symptoms are they experiencing, or if they're experiencing any symptoms. So it's very important. So it kind of goes back to the question that was just previously asked. So 2 or more, as far as contact sports, might want to reevaluate it, right? Take a break. And I know that we love football and it's hard and it's the individual's call, especially as they get older. But I believe that and think that the more we continue to educate, the more that we continue to teach our children about emotions, right? About the way that we feel, things like that, that when they start to get older, they can start seeing these changes or seeing changes in their mental and physical based on, concussions, experiences and impacts. So treatments and interventions. So assessments. Clinical interviews are very important, right? As counselors, clinicians, gathering that information, that ground information, history, things like that, that is very important as far as determining what some of these individuals are feeling. Psychosocial history and family medical history is important as well. So response during a clinical interview can also help understand familiar risk factors, including underlying affective tendencies and environmental, situational factors. So like all of this need to be taken into consideration. Behavior management and intervention, right? So developing a program. The behavior management intervention focus on mood and anxiety, right? That's one of the things that we should focus on based on previous slides, right? Depression, anxiety, stress reduction, reduce stress. They've already been in a stressful event, right? Due to the concussion, the impacts, the short-term, long-term impacts. So reducing that stress is important. Remember, right? It can cause cognitive issues, thinking, right? Concentration, concentration difficulties, racing thoughts. All of this is created, they're starting to create anxiety. So not able to focus. all turns into stress, right? It can turn into stress. So stress reduction is important. Sleep schedule. Your body needs rest. Like mentioned before in the previous slides, that you need that rest if you have experienced a concussion. As long as there's no internal bleeding, sleep is important. And creating that sleep schedule is imperative. Due with the shift and change of a concussion, it could throw out sleep patterns. It could cause difficulty sleeping due to racing thoughts, things like that. Cognitive behavior therapy is another. And also sports-specific interventions for athletes. I thought that was very interesting when I saw that. And I think it's a great idea, especially when we look in terms for athletes and also for military personnel and law enforcement or EMS personnel. Because especially like when you see a lot of athletes in football in particular, and Walton talks about this, he based a study off of youth athletes in Australia. But some of the same things that they have problems with as far as the barriers is, talking and, being able to talk more about mental health is one of the barriers that they had wanted to close. So coming up with a sport-specific intervention for athletes in that particular sport, they felt, would be helpful and beneficial to start incorporating mental health into the conversation of concussions in sports. Before I go into open discussions, what we can do, are there any questions, comments, or concerns?
I had a question about the internal bleeding portion, the myth regarding that.
Yes, ma'am.
Okay, so would it be our responsibility, especially early on, to contact the primary care doctor or refer them out in order to determine if they do have internal bleeding before we make a recommendation about a sleep schedule?
You know what? I would most definitely contact a primary care physician, a neurologist, anyone beforehand. And I think that's very important because, and just to say that, there have been people who have concussions and had multiple and never had any internal bleeding, but the way that they figure out was getting exams, getting tests, getting CAT scans to determine that. So yes, that's a great question. I'm glad you asked, and yes, for sure, contact your primary care physician, especially if you were, if a person or you are suspected of having a concussion, and even if they don't order those type of scans, that's your insurance. You pay for it, right? You know yourself better than your primary care physician. So if you think it's more, getting a CAT scan to see, why not? It's nothing wrong with being, extra careful or cautious. But thanks for asking that question.
Sure. Yeah, I was more, from like the counselor role, like what our responsibility was to refer to primary care before seeing them about treatment plan, in our field. So I guess to refer first would be the way to go, or at least consult with primary care regarding the client.
What do you think, Dr. Soli? I think that it can go either way.
Yeah, I think you can probably go either way. I think that I think that we all, I guess we always kind of want to rule out. We always want to look to the rule out, right? So I probably would depend on your philosophy, but I think you could probably go either way.
Thank you.
It also, I guess it kind of depends on why your client is coming into your counseling session. So, I guess exploring those type of, ask those questions. And when you figure out, okay, maybe it's due to a concussion, it might be due to a concussion after you've done your assessment. Then, if so, if you think it's, maybe he or she might be experiencing a concussion or had a concussion and it might be affecting their mental health, for sure, I most definitely, I would recommend them to a PCP or a physician to check it out more.
And I think that comes up in the conversation, right? Like, I think you can suss out a lot just in, in that. And even in just like, I don't know, like if someone is in like literally in the midst of it, like as a counselor, you may be able to sort of like notice, I guess, some of the symptomology, like literally in session, and then you could introduce that as a, just sort of a wondering, because it's kind of like other things, like just because you introduce it, it's like when we introduce, it sounds like you're feeling distressed. If they're not, and we've guessed wrong, they can say so.
Sure. Thank you.
No, thank you. I appreciate the question. Thank you. That was a great question. So the open discussion, what can we do? There's several things we can do. And after I go through these next two slides, it's going to be open for anyone, any and everyone, because I want to know a lot of what you all are thinking, because these are some of the questions that we need to continue to ask, explore new questions, discuss limitations, things like that. So after this, if you have any questions, you have any comments and concerns, I think it's very important to bring it up, because this is something that I think I'm going to continue to explore and continue to push, because I personally believe that this is something that's continued to be overlooked, and it's not associated with mental health. It's more associated with neurological versus both. So ways that we can get this message out, right? Let's advocate. When we look for example, for schools, right? We have football players, basketball, baseball, whoever, right? Let's advocate, right? Join booster clubs. If you're in a booster club, you have that first-hand interaction with coaches, right? Staff, right? Team moms, team parents. If you have athletes that participate in violent or these aggressive sports, be a team mom, be a team father, right? Talk about that. Bring it up in conversations. If you see someone get tackled real hard, or get hit in the face and really hard with the ball, hey, you know what? Let me talk to him. Let me see what's going on. Is he disoriented? Okay. Is he having problems? Let me talk to him. So you can be like, you know what, coach? I don't think he should go out when that coach try to make him go out, because that coach will try to make him go out. I'm speaking from experience. They will. So that's important for that. Parent organizations in the school, right? You got PTA, PTO, get involved in the school districts, right? School boards, go to school boards meetings, discuss that, especially if you don't have have a concussion protocol or policy within the school district. Bring it up. CDC has a lot of information as far as protocols and policies. Local, state, and federal legislation. This is not a state issue or a city issue. This is a culture issue. This is a local issue. It is a state issue. It's an all around issue. It's a concern that needs to be addressed. And hey, go to city council meetings, right? Advocate for your school district. Go to city council meetings. Go to state and federal legislations. Talk to your council members, your council women, the council men and women, your senators, right? We all have that type of resource to write. We can do it and express as a constituent, as a voter, right? That this is important for me and my family. Culture, right? We discuss culture. Can we change how sports view concussion and mental health? That's a great question. Can we change that culture? Understanding individuals' cultures. That's very important, right? That can also affect concussion symptoms and outcomes. Health and mental health history, right? That's also important to understand. So I want to leave this open for any questions, any discussions, anything that you think that needs to be explored more, right? Has anyone ever experienced a type of concussion? It doesn't have to be sports related. It can be even work related, home.
Darrell, we actually had a question in the chat pod that said, let's say if determined that we discover we are dealing with concussion-related depression, how would treatment differ for us as a counselor?
You know, I guess it goes back to the individual, right? Understanding who that individual is. I know one of the articles I was reading was explaining how to get more people that experience concussion to be more open about it, right? To experience, to express themselves more about the feelings that they have, in right. So I think it kind of goes back to their history, their culture, how to implement that into an actual counseling strategy or treatment plan. And like I mentioned before, even like a sports-based therapy, changing it up from that perspective and make it more sports related.
And I think too, like, you know, when we're working with someone who has been concussed, and I would say that this is probably more of a, obviously if someone is concussed and then are experiencing depression and that's why they come to see us, I would say then that would really be a place where we would certainly, go into some of the more brain-based, like, other symptoms that can trigger depression, right? So like part of it depends on, like, are they coming to us for this, or did this happen whilst in treatment with us, and how that may impact the treatment? Because the very little that I do know, and I'm not going to lie, like, I'm supporting Darrell in this, I am absolutely not an expert when it comes to working with concussed people in counseling. That is something that if that came to me, it has occurred to me that I might want to do more research on this. But if that happened to be a population that I was working with, I would certainly want to do a lot more research and reading in the literature about how to differentiate. One of the things that I do know is, like, just in terms of like of our brains and what our brains do. There are like behavior inhibition systems that could be impacted, like when we, it's like that pleasure center. Like if we keep losing things that bring us pleasure, that in itself can cause depressive symptoms. So like that may be an avenue to like explore. Another one is just like bringing up the potential for just how like the brain chemicals may have been impacted by the physical concussion itself. And so those might be different conversations to have with the client. And I think part of that is just like weaving in that we are holistic beings. It's very important for us to make sure that we are bringing that whole together and addressing, this isn't just your brain and then this is your depression, but like when you have these things interacting, it may be of a different, it may be different. So I think that it has to start with the conversation. And, to be honest, because there's so much, like the explosion of brain research right now is literally like, it is just like, it's expanding. I think that this is probably an area that we're going to see a lot more attention to in the next couple of years as it becomes more, also the relevance of concussion on mental health, just I've noticed in the last year in media, has become much more prevalent. So my hunch is that there's going to be a lot more direct answers to that question, Jamie, in the near future. Another question that came up was, how might we help navigate memory loss in a concussed client? For example, if we've had sessions with a client prior, and then they have that particular client returns with memory loss related to a concussion, how do we navigate that? I'm going to ask Darrell if you have any thoughts on that.
I actually don't have any thoughts on that.
Okay.
So, that's a great question. So how would you bring them back to the present, right?
Mm-hmm.
Mm-hmm.
I'm curious if anyone on the in our meeting has any any direct experience with that. Any thoughts? I can tell you my immediate, I guess, thoughts just from a clinician's standpoint, because certainly, I mean, memory loss due to trauma is, I mean, there are some elements of that might apply, but I would really invite anyone else to bring their voice and their thoughts to this discussion as well.
And when that's a good question. That might be something that you might want to explore a little bit more. It might be something else.
As a counselor, I think that would be something I would refer them to, maybe pose to a neurologist. As far as the memory loss, I don't think that that's an area that we can possibly help them in as professional counselors, but because it sounds that there's definitely some physical attributes to, if they could, from being concussed to their memory loss, I think only a neurologist can really address that question. That's my take on it.
You know what? Thank you, Mr. Gary. I like that answer, and that is something that that I wanted to continue to push. It's like that, as well. Get more further get further testing. It's very important to get further testing. So we, like you said, that could be something that is outside of our scope that needs to be dealt with from that perspective, and it needs to work. It needs to work both ways, right? And the reason why I say that is because, like you said, Michael, you will refer them to an outside source, right? To a neurologist, right? To see exactly what's going on, right? And that's very important. But we need the same type of care and love from the mental health side as well when they go to these individuals as well. And when individuals are expressing, yes, I do see a change in my behavior, I am angry more, or I do feel depressed, we need for them to say, hey, you know what? Sure, you know what? Okay, we see your brain scan, this is what it is. Oh, but you know what? Hey, you might want to start looking into getting some mental health, and we can focus on anger, depression, or things that come with it, right? Suicide, alcohol, substance abuse, things like that. So yeah, I think it's very important. I think that's the right way to go. And also it needs to work both ways though.
I agree. Because I guess I'm thinking that the issue would probably come up basically because of the client feeling some level of anxiety, concern, at the idea that they're recognizing that they're having some memory loss. So, I would see my, I guess, how I would be useful is just affirming, what they're going through and what they're experiencing, and help give some viable information as to why it will be helpful for them to possibly go outside and as far as referring them out and seeing a neurologist. I had a question I'd like to I'm gonna say get your thoughts on, and you may have anticipated that this would probably come up. But, the incident yesterday in South Carolina, where there was a shooting, 5 people were killed, and the apparent perpetrator was a former NFL player. And this player was, apparently being treated for a mental health disorder. And so I was just kind of wanted to get your thoughts on if you see any correlation with, because he was an NFL player, may there have been possibilities he experienced concussions in the times in his experience as far as his playing, how that may attribute it to his mental health, and getting to that place for him to, commit such an act.
Yes, and I'm glad you brought that up, and I hate that we have to bring it up.
Yeah.
The situation, the circumstances surrounding it is pretty brutal, but it's important to talk about, because when I saw that article, right, the first thing, well, I'm not gonna say the first thing, but when you read into the article, right, it mentioned multiple concussions, right? When you look at Aaron Hernandez, he's another athlete, right?
Yes.
He ended up committing suicide, but you know, was in jail in prison for murder and organized crime, right? And that has a lot to do with, and they mentioned that he suffered severe CTE. So yes, when you see it, it's very, very, the correlation runs together. Even when you look at the drug addiction, well, not even the drug addiction in the NFL, but but drug addiction, yes, I would say that. And also when you look at the individuals that get suspended for increased marijuana usage. And a lot of them will tell you the reason why I smoke is because of the pain, right? Or do drugs is because of the pain. And it's more the physical pain and also the mental pain of it, right? The depression, the anger. So they all run together. And you know, when you having those type of issues, and you know, I just think that every case is different, right? The severity
Yes.
of it is different. His was very severe, unfortunately. You know, Junior Seau, I'm not sure if anyone's familiar with him. Great football player. He retired, was on NFL TV. You know, you look at him, look good. You can tell he still worked out, had clothes, you know, nice, still, you know, was great. Smiling, everything, right? What, next week later, he ended up shooting himself with a shotgun, killing himself, right? And that's what they mentioned, concussion. So these are something that we bring.
I'm just trying to be mindful of our time. I know Caitlin had mentioned about 10 minutes ago that we had about 10 minutes left, but I just want to kind of chime into what to this conversation just really briefly, Michael. And I think that, you know, I think that anytime we as, you know, I think that we as counselors have, we always carry a due diligence, you know, around, you know, around reporting. And I think that when we, I mean, and I have, you know, I have interacted in my younger days with a few people who had played professional football, and they basically said everybody gets concussions. Like whether, and I think that now it's more everybody who plays professional football, not everybody like mainstream, but like that was just so much the norm. And like this was a while ago, but like that was like everybody does. And so I think that, I mean, without being assumptive, I think that it's important to, I guess, remember that, and I think that that was really kind of the element of what we wanted to make sure with the people are walking away with this presentation is like the understanding that, you know, that concussions can and often do intersect with mental health. And if we know that someone has suffered multiple concussions, then perhaps we are listening to them with a different level of ear. Maybe we are probing into areas that we, you know, that we otherwise wouldn't. But I think that as counselors, you know, if this person had mental health issues, I mean, from the case in South Carolina yesterday, you know, were they seeking treatment? There is a stigma amongst pro athletes that seeking mental health treatment is not okay. I know actually one of our faculty members here works with a pro team, and it has become, and there is a huge barrier there. Actually, the head coach of the Cleveland Browns was our keynote speaker for this conference last year and talked about the importance of mental health with pro football. And he specifically spoke to, you know, these athletes, these young men who, you know, have these, you know, images of, you know, keeping it, you know, keeping it in the family, whether that family is football family or actual physical family of, you know, family of blood or family, you know, family of choice, but that like seeking mental health treatment is not the norm. And so, you know, I think that it takes a lot of advocacy, not only on our parts as counselors, but also on the parts of the pro health, or I'm sorry, the professional athlete, you know, those who have influence over them, to really break down those barriers and start to make the connections for these, you know, young men and women who are out there exposing themselves to the possibility of being concussed, that there are also mental health issues that oftentimes coincide with that. So kind of wanted to throw that out there. Thank you very much for your for your time today, everyone. Caitlin, could you come on and just I know we have some questions here. Are they supposed to do that here? Are they supposed to do this somewhere else? I'm a little unsure about.
From my understanding, they're supposed to answer in the chat.
Okay.
So that's what I'm following. So if you guys can answer in the chat,
Okay.
and I believe the chats are going to be saved. So
Okay.
Yep.
Thank you.
and,
Well, thank you everyone for being here.
Yeah, thank you.
Darrell, thank you so much for doing this. Great job.
And I thank you, and thanks for doing it with me. I appreciate everyone attending.